Right, so like promised that we're going to have in studio our guest this morning to discuss further and speak for Pankaj Chandna.
Yes.
I said that right?
That's right, sir.
Okay, cool. He's coming from Vaidam Health and telling us more, of what they are and especially speaking to the importance of evolving with technology. When you talk about Vaidam Health, what are you doing here in Zambia and what are you all about?
Okay. Well, first of all, good morning, Lusaka, and thank you, Machumanda, for the platform. So what happens whenever anyone falls sick and unfortunately patient needs a procedure?
Right.
Now, whether procedure has to be done locally or it requires a referral abroad, patient contact us. So we started as a program where we were promoting hospitals and healthcare in India around the world, and we have received patients from 100 countries who came to India for medical treatment.
Right.
Now we did not stop there. We added more destinations, and so we started as a program where we were promoting hospitals and healthcare in India around the world, and we have received patients from 100 countries who came to India for medical treatment.
Right.
Now we did not stop there. We added more destinations and more countries where people are traveling for healthcare. So right now we operate in 8 different destinations. We receive or assist patients in India, Thailand, Turkey, Germany, Spain, Egypt, Malaysia, Dubai, so on and so forth.
And now Zambia.
Yes, so that was our first program, like,
Right.
We were referring patients out of their country where, something which cannot be done locally, and doctor says that, this better that this is done outside. Now, after having done that, by the way, we are a 7-year-old platform, and in this last 7 years, we have handled close to 15,000 patients from 125 countries.
Right.
Now, what happens, we realize that traveling for medical reason is not ideal. Whatever can be done locally should be done locally.
Right.
Even if, let's say, all the required technology and processes may not be available, so we want to work with local health system to see how we can help them upgrade and uplift to where, even the complicated procedures can be safely done in their own country. So that's when I mentioned that we are not longer just a platform which tell patient to come out of their country and go to different places. Now we bring doctors from any of our network countries into the countries where patients can be treated locally. Now this is the chapter 2, as I mentioned.
All right.
So we want to bring doctors here and work with local authorities so that whatever procedures can be done here should be done here.
So the process is by identification first. So for instance, you have a patient in Zambia who has a certain ailment.
Yes.
And then you get to speak to a specialized doctor in that area and transport them to Zambia and they come to perform that.
Yes, so what
that's at a cost, right?
Yes, so actually, for example, there is a patient here, let's say the patient is a child pediatric case, and patient is identified with a cardiac issues,
Yes.
which unfortunately cannot be performed by local doctors because of the lack of infrastructure or the expertise, or it's a complicated case. So then we bring the network of doctors, let's say from India, hypothetically saying, where they discuss together that can this case be done locally if, let's say a team from India travels in, and, the local doctors and everyone collaborate and join hands together to do the procedure here itself. So we are not telling patient to travel anywhere. You have very good infrastructure. I have visited some of the hospitals, whether it is UTH or National Heart Hospital. We work, I'm here, mainly we work with our partner, St. John's.
So we have the infrastructure. Do we have the equipment?
Yes, I mean, you cannot say that there is no infrastructure. That is absolutely not true. See,
so we have the infrastructure,
yes,
like you mentioned, but
yes.
we have the equipment.
Yes, you do. I am saying that this is never a 0 or 1. The answer is not 0 nor 1. There are shades of gray. Right? So it's not that even in India or in Turkey they have all the equipment. Even they are looking for more and more technology. So it's an evolution.
Right.
It's evolution. Maybe in India, let's say the availability of technology is 9 of 10. Maybe in Zambia it is 7 of 10 or maybe 8 on 10. So there is always some gap. It's not that no one has reached a perfection. It's just that we always have to keep evolving because science is not stopping. There is every day new drugs, new technology, new equipments which are being produced, and we have to learn to adopt them and see how we can make a use of them for patient safety and best clinical outcomes.
What is the importance of evolving with technology in the health sector?
So I always give an example. So in let's say 20 years ago, when a neurosurgeon has to do a brain surgery, let's say a patient is identified with a tumor in the brain, or the doctor has to do a spine surgery and it's a complicated spinal tumor. Now the doctor, as we all know, they will cut open and they will remove the tumor, and obviously they are seeing from their naked eyes and they are performing. There are newer and newer techniques which are made available, and one such machine, let's say, is called neuronavigation. Think of it like a GPS which is guiding the doctor which path to take, and if doctor is, let's say, is like inadvertently or accidentally touching a healthy nerve, or which can damage the healthy nerve, so the neuronavigation machine makes a red flag not to go there, not to touch it. So that makes it's so much more patient safer. You understand?
And that's at the diagnosis level?
No, this is actually used in the operation theater. While you're actually doing the procedure, it is not a pre-procedure. Of course, even in the pre-procedure, there are high-end MRI machines. Now, we have 3 Tesla MRI machines available. People are talking of moving to 5 Tesla and 7 Tesla. The higher the technology, the better is the diagnosis. Otherwise, if the diagnosis is not complete, you cannot treat a patient completely and safely. It's like then shooting in the dark. You're just trying, do this, do that. And we are putting patient at risk.
These machines don't lie.
That's true. So it's I always believe in healthcare, it is not just machine, it's a combination of man and machine. The man who is operating the machine also matter, and the man who is interpreting what the machine has told is also matter. Because sometimes, when the surgeon, they see the report, they see what a radiologist has written. They are not sitting in front of the MRI machine. So if, God forbid, if radiologist made a mistake in reporting, then everything changes. So it's always a combination of man and machine.
So now you bring this initiative to Zambia, and we are in the digital space. How much of is it popularity have you pushed to the people for them to understand your operations and know?
Okay, so see, as I mentioned, we are a 7-year-old platform. I think from Zambia we may have handled more than 300 patients for various medical illnesses.
300?
300 plus.
Right.
And be it cancer treatment, be it kidney transplant, bone marrow transplant, or high-end cardiac surgery. See, there are very good doctors available here. No one is saying that there are no doctors. There are procedures, whether it is orthopedic or spine, that everything is being happened there.
I was going to ask that, how is the interaction of choice when it comes out to appointment of these doctors after identifying these patients or those that have approached you in a way? Is it outright that you're going to seek help from those from India or elsewhere across Zambia, or you do make use of the human resource which we have?
Yes. So see, as a company, as a platform, we started as a digital platform. Just to give you an idea, we have 35,000 plus unique visitors on our website every day. So that means we are touching more than 1 million traffic who visit our website looking for medical treatments around the world. Now, in the beginning, for the first 4.5 years of our journey, we were purely digital. Everyone was only coming to us through our online platform, dropping their inquiry. Then our team used to help them finding which is the best doctor, what are the right price, how this procedure can be done, and so on and so forth. Now, after having done that, now we start doing this outreach program, like what we did just recently with St. John's Hospital. We invited 2 surgeons from India. One was a cardiac surgeon, one was a medical oncologist, and we consulted patients. We gave them options, what line of treatment they have. Many patients availed this opportunity. We saw more than 100 cases who came and just took a second opinion. They are already doing treatment here. They are doing all right, but they wanted a second pair of eyes to see, how is everything going. And doctor were very happy to say, your doctor is on the right path. The line of treatment is correct. So continue that path. The patient were also very relieved and happy to hear that.
Right. According to your observation, how Zambia reacted to the space of digital evolution when it comes out to the health sector?
So obviously, in the beginning, there are a lot of scams on internet. Whenever anyone see anything on internet, the first thing, oh, there's a scam. There's something going on. So it was not easy in the beginning, but as we say, when you have one happy patient, when you have 5 happy patients, when you have 20 happy patients, the word spread. People get to know that this is a genuine platform. They are really trying to help people getting treatment. So in the beginning, it's never an easy journey, but thankfully we have crossed the barrier where patients don't look at us with the eye of suspicion. They are now actually saying, okay, I know you are a good platform. Now help me what I need, what to do, how to do, and how you can help me.
Right. And this also trickles down to individuals. When you talk about, I think it's a big sector, as in health, with that approach. But there's also the individual level where one can equip themselves with the digital equipment, just to take the basics, obviously. Maybe BP, this and that. How important is that as well to have?
So, see, everything comes with its own pros and cons, and I always believe that number one, patient should not self-prescribe. It is very dangerous. Let's not undermine the education which doctors have taken 5 years to 7 years for their undergraduation and then masters and then super specialization. By just reading Google or Facebook for 10 minutes, we should not undermine what doctor knows and what he says. So I tell everyone not to first of all do self-medication. Yes, healthy lifestyle and lifestyle changes, especially in today's world where most of the problems that we deal with are lifestyle related. Smoking, drinking, not doing enough workout. Our forefathers used to eat a lot, but they also used to work out a lot. Now we learned the habit of eating from them, but then we are driving and we are sitting, so that is causing a lot of issues internally in world over. It's not a Zambia problem, it's not an Africa problem, this is a world problem now. So we have to solve it by going back to basics on changing our lifestyle and doing things like this.
What do you think should be done to improve the usage of technology in the country, especially Zambia?
First of all, the first important thing is that the stakeholders, the government, the regulators, everyone has to understand and appreciate that yes, this is something we want to do. And I believe that awareness is there. I'm not saying that they are lacking, that they don't acknowledge that they have to move in that direction. So yes, it is there. I'm sorry to say, but in most places, including United States, I have worked even in United States where the adoption of technology is very difficult for doctors. They are happy, with the old ways because that's how they are being taught, paper pen. So bringing doctors to use system is not easy, but then, it's a slow journey. Like I said, everything is an evolution. You can't just do a switch on and off and everything will change magically. So doctors slowly realize that, by using technology, how it is helping them in future, this is helping their patients and everyone around.
That sounds so good. And, space that Zambia's response, has been, at the greater level. What do you wish to do to improve it further?
The usage of technology?
Absolutely.
I believe so. Like I said, so we want to now collaborate with the stakeholders, be it NEMA, be it the Ministry of Health, and collaborate with the local hospitals where we see that there is a huge opportunity to do more and more things here. We have investors in India and other places who are even ready to put their investment in a country to bring, or upgrade the infrastructure availability. These are long-term projects. It's not a 3 months or 6 months because we are talking investment into the tune of millions. So people want to make sure that their investment is safe and they can recover their money over a period of time. So once they get that assurance that yes, Zambia is a safe place, good place, opportunities are there, once all those check marks are ticked, then the investment comes and then it is good for everyone around us.
Right. I'm glad we've tapped into your energy and effort. I would also give you this particular platform, just in case someone is sort of listening to us and watching us at the same time and they're interested. How do they even find Vaidam Health?
So as I said, our prime source, how people find us is through our platform vaidam.com. I encourage everyone to visit www.vaidam.com and they will see all the hospitals and doctors we work with. They can find the price of treatment, the chances of success and recovery. So we are very easy because we made this platform thinking a common patient in mind. It's not something that you need a rocket science or a special techniques to maneuver our platform. It's very simple. I encourage everyone to spend time. They will see how beautiful and how simple it is to use.
Right. So just to go, and build confidence in the public, that they're watching. You talked about scamming earlier. Are you affiliated to the Health, Professional Council of Zambia? Or Where are you affiliated? So that someone really
Yes,
has the confidence
yes.
that you are.
So there is a accreditation body in India, because our company is headquartered in India.
Right.
So that company accreditates a platform like us. It is called National Accreditation Board for Hospital and Healthcare Providers. It is NABH. So there are about 250 hospitals that they have accredited, and they have accredited companies like us. So I can proudly say for the last 4 years we are NABH accredited, and they come and they check our processes and our policies, and about how do we ensure patient safety and security and data and security, all of those. So we just renewed our NABH 1 year ago. So we continuously assess and make sure that we follow all the guidelines and protocols.
Right. For credibility's sake, for one who's watching, I had to ask that question. But I would love to thank you very much, Pankaj, for coming through and sharing with us. I think that's going to be off the cuff for us to discuss that. These are important conversations that need consistency and, of course, speaking to the public every time.
Yes.
Otherwise, thank you so much.
Thank you very, very much.
Best.
All the best. Thank you.
My name is Machamanda. We continue the Daylight Breakfast. Now he's coming up with Professor
Charles Michel.
Right.